Hello, Dr. Aruna.
Hi Swati, good morning. How are you doing?
How was breastfeeding week celebrations? I heard you did a lot of talks, online talks.
Not a lot, not as much as you guys. Coimbatore Parenting Network has been really, really active. And I think you specifically in your individual capacity have done a lot.
Yeah.
You know?
Yes, ma'am. Yes, ma'am.
So in my own small way, whatever support I can give to the mothers at hospital, that's what I've been doing. So
Okay.
that's what my week has been like.
Yes. Doctor, I've always wanted to have a separate session with you because you're one of the pediatricians, neonatologists who's also a board certified lactation consultant.
Yes.
So it's very rare to find that combination in our country where lactation is just booming, just coming up. People are yet to understand the complete scope of the profession itself.
Yeah.
So I wanted to know how was your experience as a pediatrician before doing IBCLC?
Okay.
Yeah.
So I think you would be familiar with what a typical pediatrician's clinic is like, Swati. So a lot of screaming, crying children, a lot of anxious parents, and you don't get a lot of time to spend with each individual parent. So you're trying to do a lot of things. You're trying to listen to what they're saying. You're trying to assist the child. You're trying to come to a diagnosis, and then you write a treatment and try to tell the parents what it is. And in the middle of this, if a mother comes up and says, "Doctor, I'm not able to breastfeed," or "I have some pain," then you just have some basic theoretical knowledge which you had in your MBBS days, or maybe to some extent in your post graduation.
Okay.
And then in that limited 5 or 10 minutes, you just tell her, you do this, you do that. But there is no time to actually listen to her or to look at her feeding. So I think that is where I missed out on a lot of nutrition.
Okay. Okay. And what made you take up the IBCLC exam?
Yeah. So I was a pediatrician like for donkey's years, 20 years or so. And then I did my fellowship in neonatology. So I was like a deep dive into neonatal intensive care for a year. And then I worked in a hospital. And then things really started to slow down. And I kind of woke up and looked at the parents who were there. So we were focusing so much on the little ones and their health and not so much on the stress that those parents were going through, especially the moms. And I think it feels really bad, but to say that my have been, we need your milk, or just pump more often, and never go to their level and see what exactly the problems that they were facing.
Okay.
And then I had a very good supportive team, and they said, why don't you just specialize, do go further into breastfeeding. So then I did my BPNI course, which is here in Delhi, and it was very informative. And
Okay.
that is where I heard about IBCLC for the first time. So I
Okay.
decided to go further, deeper into it, and just pass the exam. So one more thing I need to discuss at this point is I had a baby. You may have seen babies like that, Swati, born really stressed, traumatized, screaming all the time, never come to the breast, very difficult to comfort. And this was in my early days as a lactation consultant, and I was really stumped. I knew the basic mechanical things like pump mother's milk, finger feed the baby, try skin to skin, but this baby never came in. And then, by some stroke of luck, Ifat Yasmin happened to be in Bangalore, and I connected with her.
Okay.
And I arranged a consult with that mother for Ifat.
Okay.
And then I was there just sitting and observing, and I saw the whole tone. It was in my consulting room in the hospital where I work in, and I know what the tone of that clinic is. It's always busy and very left brain. So this mother and the father came in with the baby, and Ifat came in, and she just sat down and spoke to them. The whole emotional tone changed. It slowed down, and it was so beautiful. And I knew that okay, this is what an IBCLC does. It is not just suggestions or telling mom you have to do this, you have to pump like this. It's really an emotional, gentle connect where a lot of space is given to the mother and the baby. And that kind of set me on that path. So even now I always look back to that day and think, that is my standard, that's my yardstick. If I'm able to help a mother to that level to which Yasmin did, I think I would be really happy. So
Right.
that was how my life changed, and now my consults are much slower.
Okay.
So I take time. Even if it's just a pediatric consult, I do take time. I do listen to the parents. I like to look at the baby. And because we've been doing breastfeeding help for so long, we know how there are, physical changes which can affect breastfeeding, say flat head or torticollis. So I knew this as a pediatrician, but I did not connect it. Very stupid of me, but I did not connect. But now I see the connections. So even if they haven't come to me specifically for breastfeeding help, I am able to help to a certain extent. And my practice, my time with the mother, the father, and the baby has really slowed down. I always like to see a feed. Even if they come for a vaccine, I always tell the mother, please, can I see a feed? And I just like to sit there and watch. And I read somewhere that if a baby is really transferring effectively 60 sucks a minute, that's our heart rate, that's our adult heart rate. So when you're watching a really successful feed and you slow down, and it's that kind of a really high vagal tone, and it really sets the spirit for the entire consult. So if you ask me how my practice has changed, it has slowed down. It has really slowed down.
Wow. Okay. So I think I wanted to ask that question. I think you've already answered it. How is your practice different now was my next question. So you've already answered that.
Yeah.
So Doctor, what is your opinion about tongue ties? Because it's pretty controversial. A lot of contradictory information is there out there. There are some pediatricians who talk about it, some who don't. There are pediatric dentists who are in this field. There are some ENT specialists who are focusing on this. Lactation consultants are going around telling. So, what is your opinion on this?
Of course, we do assess the oral exam at birth and in the postnatal ward. And whenever I notice that there is a tie, I tell the parents that there is a connection here. All of us tend to have it. Some tighter and maybe, smaller than the others. And I always tell them we will have to reassess the baby because they tend to panic a lot. That is what I've seen. And at reassessment, again, the functional assessment, if I find that it's not really harming the breastfeeding relationship in any way, that is what I tell the parents. If I find that it is affecting, then I also give them the options. Many of them, Swati, I tell you, they don't want anything done. I don't know what the experience is with you, but here what they say is, we'll just wait, doctor. I don't want anything done.
Yeah.
And then, the help goes along another way where it can be the least pain-free for the mother, making sure the baby's feeding goes well, and also body work. I think that we'll have to discuss later. And those parents who really opt, for the frenectomy, then the facilitation goes along other channels. But it's not like I deny it. I know it is there, and I try to explain to the parents what needs to be done. But the final decision is theirs. I just present the facts. What they want to do about it is their decision. That is how I handle the ties.
You came to know about tongue ties in the beginning of your practice itself, or after starting your lactation?
What are you talking about? As a pediatrician, 100%, you don't focus on it because it was not in my training. I don't think it is even in the training now. It is not in the BPNI training also, Swati. So when I did the BPNI training, there was no concept about looking for ties, no concept about even doing an oral exam. I don't know how that works. It's only through the IBCLC thing that I came to know of ties as being present and affecting function. So my knowledge is only post my IBCLC. I did not have it earlier.
BPNI, I mean, our viewers might not know, it is the Breastfeeding Promotion Network of India, which is an NGO that focuses on breastfeeding promotion and preventing artificial milk from being overpropagated and all that. So even in that level, the knowledge is yes.
So I did my course about 3 years ago, and my colleague did it last year, but nothing much has changed. There is no internal oral exam like the way we do the digital exam. I don't think that is there. I don't think they've touched on ties, tongue ties, or lip ties.
Okay. And one more thing I'd like to talk about now that we are on tongue ties is the most popular opinion is only if the frenum is at the tip of the tongue, it's considered to be a tongue tie from medical professionals. What about you? How do you do the evaluation? How do you?
I go right in, I do the digital exam, and there would be posterior ties also. So it's not like I don't believe in ties or something. If it is there anatomically, it is there. Right. So to my knowledge, what I can counsel the parents, I do it, Swati.
Yeah.
So, but the ultimate treatment, how they're going to deal with it, that is entirely the parent.
Yeah. So you have obviously come across clients who had ties, but then it just got better over a period of time, and the baby really started sucking well. You have come across such clients also, right?
Yes. Yeah. I don't think it has got better. So that is one question they always ask me, will it go away? And then we have to say, no, it is always going to be there. Right now, maybe it is not affecting your relationship, but that doesn't mean like, when the child starts speaking or solids are started, it doesn't mean that it is not going to affect the child then. But then that is something they say we will take a call about it later, because right now it is not affecting my breastfeeding relationship. And even if it has, I've seen mothers who just kind of gritted their teeth and persevered
Yes.
through very pains just because they're afraid of the tie, or maybe they are convinced but the partner is not. So there are a lot of dynamics involved here.
Right, right.
So what I limit myself to is just support and maybe information.
Mom who breastfed a tongue-tied child, but then it didn't actually affect our breastfeeding relationship at
Really?
all.
Okay.
But later on, it had other
Yeah.
issues, other compensations had developed,
Yeah.
and there
Yeah.
was a lot of sensory aversions. She was
Hmm.
not taking a lot of textures. Though
Okay.
she was a self-fed child, there were a lot of things that she
Hmm.
completely
Hmm.
avoided. And the moment the frenectomy was
Yeah.
done, it was almost like magic. She started trying different kinds of textures. I never knew
Oh.
there was a lot of cavities at the back, and
Oh.
because the tongue wouldn't go till the back of the
Correct.
mouth, and
Correct. Correct.
those kind of issues
At
had
what age did you get her frenectomy?
at age 5. Yeah,
5 months.
5 years.
5 years.
Yeah.
Oh, okay. How did you even think that you should get her assessed for the tie?
Ma'am, I've been seeing all these compensations from the time she was 2. I
Okay.
started observing these compensations, and I was also reading a lot of literature by Dr. Bobby Gaheri and so many others. So at one point, I was convinced. I was very convinced that this is what is creating issues. I was so convinced, and then when I made up my mind, I decided to go in for a frenectomy. Yeah.
Okay. All
And
right.
immediate changes, a lot of changes. Certain letters which she couldn't pronounce, she started saying that very clearly. And she started cleansing her palate much better. Before, all
Hmm.
food will be inside the mouth itself all the time. A lot of
Hmm.
pocketing the food, pouching, keeping it
Hmm.
inside, and chewing for a long time. Meal
Yeah,
time
yeah.
very long, and there was excessive gag reflex was there.
Okay.
So many things were there. It
So the
all caused.
classical history, the way you
Yeah,
describe.
but it didn't affect our breastfeeding at all.
Oh, yeah.
I don't know.
Correct. That's what they
Yeah.
say. Just because a tie is there doesn't mean that, for different children it may differ and, behave in different ways. Maybe it was like that.
And what about body work? How did you
Oh,
start
yeah.
believing in body work?
So that again goes back to effort. So one of my first babies with tongue tie,
Okay.
she happened to come in. I went with her for the laser release. And then immediately post the release, she did a bodywork session for the baby and the mom.
Okay.
And I was standing behind her in that dental clinic, and there was such a wave of peace and space. I can't even begin to describe it. It was so beautiful. And I had no idea what was happening then, but then I realized, okay, she was doing a CST session. So maybe I felt the benefit of it behind her. So that really left a lasting impression on me.
Okay.
And the other baby I spoke to you about, the really screaming, crying baby, I saw her deal with. So
Okay.
she suggested some CST practitioners here in Bangalore.
Okay.
And then I was at the very beginning of my journey. I had absolutely no idea who these people were. And then I gradually connected. So
Okay.
this was Sangeeta. And then a lot of my babies, I used to refer to her stress traumatized babies, babies with the tight, oral function, or torticollis, or plagiocephaly, or generally very, very screamy, cranky babies. And every time there was a really, really good, effect.
Okay.
And then through my IBCLC studies, I realized that body work is one of the suggested treatments for any breastfeeding issues, because
Right.
it's so gentle and so non-invasive. And like you spoke in an interview to Yasmin, it is magic touch.
Yeah.
Basically, it's just really affects the baby so positively on so many different levels, and not just the baby but the mom also. Why not? So I was so converted to craniosacral therapy. I also tried to learn it. I did about 5 sems, and then I just kind of gave up. But hopefully sometime in the future I really need to do it. So I'm really a big convert for craniosacral therapy.
Because it's so interesting that you know so many different disciplines come into play
Yes,
when it comes to lactation, right?
yes,
It's not simply latching positioning,
not at
because
all.
that's what
Not
people
at
think.
all. Yes.
Yeah. Okay. What would you like to tell pregnant women how to get prepared for breastfeeding?
Correct. So I'm just going to share this graph, which I really find interesting. Can you see it? Can you see the screen?
Yes.
Okay.
Yes, doctor.
So this graph I found during my IBCLC training, and I found it really interesting. So if you can see this black curve, that is maternal concerns about breastfeeding. You can see how it's really very low before the delivery. This white interval is the actual period of, I think, childbirth.
Okay.
So you can see how the mother really starts off kind of
Not being
very
too worried about it.
unconcerned,
Yeah.
very unconcerned, which typically I see.
Okay.
So they come into childbirth totally unprepared. So I'm going to talk about, preparing for breastfeeding, not so much childbirth education, but I think it would be equally important there also. So most mothers I see, they're educated, they're literate, they're working women and totally sorted otherwise, but zero preparation for breastfeeding. And that is how they come in. And on day 1, 2, 3, because that is when I have contact with them, they have no idea how to hold the baby. They don't know what a latch is. They don't know what colostrum is. They don't know how breastfeeding is supposed to feel. They feel pain is normal. They don't know how, swallowing sounds, what is effective breastfeeding, what to look for, what is a good pee count, what is poo count. So a total ignorance about this, I think that has to change. So every pregnant mom has to go to a good breastfeeding class, club it along with your childbirth classes, get really informed. You need to know all these basics. And the time to learn is when you're still pregnant and you have time. It's not when you have a baby on your lap and your nipples are hurting and you're engorged and you have no sleep. That is not the time to do it. So I feel this part is when mothers really need to get informed about breastfeeding. Okay. And then you come to the actual delivery, which is this white part, and you can see the enormous influence that maternity staff has. So I feel this is where a hospital-based lactation consultant will really help. So if you are fortunate enough to be born, to give birth in a place which has an LC, take total advantage, because then there's nothing like that. If you don't, take the help of maternity staff, but also you would have to use the good sense and knowledge that you gain from your breastfeeding classes and use that as a screen. So some maternity staff who are not very well trained are very, they just give us some comment that they say, okay, you don't have milk, or baby's crying, maybe you don't have enough breast milk, or they say your nipples are flat, or something like that. You need to have the knowledge and to apply that good sense. And we all know we are very sensitive and the hormones are all over the place at that time. And even a stray comment can really stay in your head for long and can really affect the journey.
Yeah.
And if you can see what happens later, this red curve, which is family, workplace, and societal pressures. So this really starts building up. And when you have a new baby, your entire family, maybe your neighbor and whoever is in your apartment complex, they become breastfeeding experts. And what they push at you is their breastfeeding story, which may or may not apply to you. So you really need that filter of good sense to know what to use for your journey and what not to use. And again, here, getting a basic breastfeeding education. That is what I feel is really important. And what this purple curve, that's your pediatrician whom you're seeing. Choose someone who is slightly breastfeeding savvy, a lactivist type of breastfeeding friendly pediatrician. Or if you can't do that, if you are facing some problems, please go and meet a lactation consultant. So I felt this graph was very indicative of what I want mothers to know before they are, they have the baby. And also some mothers seem to think what happens in the labor room does not affect their breastfeeding relationship. But that never happens. So it's like a cascading effect. What happens in labor and delivery room affects your postnatal whatever period, and that has a really big impact on what is happening to the remaining of your breastfeeding journey. So I think making really good choices about how you're going to deliver, where you're going to deliver, all that has to be decided beforehand. I know life happens and things may not be in your control, but at least you would have the knowledge to have, to make good decisions. So I feel being prepared is very important, and that is really the first step of a good breastfeeding journey, which is why I wanted to share this particular chart with you.
Okay. Thank you for that. I think my next question was suggestions for a good breastfeeding journey.
Yeah. So this kind of flowing in, so being very prepared, as much as possible to go with the flow. Try and have a natural, normal delivery.
Yeah.
Many moms I meet opt for elective cesareans because they're afraid. And if you have so much fear, please get some help. because what you're feeling as fear is what your baby would also feel, and that is not a foreboding of a very good delivery or a postnatal. So really get good childbirth advice, meet whoever you want, relax, whatever, but allow the natural journey, the pregnancy, whatever, to progress to date, and let the delivery process start off on its own,
Right.
have as possible, and then things are almost halfway there. And then just going with the flow, holding your baby a lot of skin to skin, that really kickstarts and helps the breastfeeding journey. Some mothers are afraid that if they've had a cesarean, they'd have missed out on that one golden hour of skin to skin, but you can always catch up.
Right.
So whenever I meet moms and dads, so my intense contact is for the first 3 days after birth. I always tell them, hold your baby a lot. You need to. And then they say, no, doctor, I think the baby will get used to it. And night and all, we will have to hold. But then, I have to convince them that this first 3 months after birth is the fourth trimester. Your baby needs to be held. And it makes me so happy that the next time when I go in, baby's actually here and it's not in the cradle far away. So that's like a small battle one for me. And then, actually keeping at it consistently, maybe recurrent breastfeedings through the night, that is the norm. There's no way you can kind of escape it. And as much as possible, go with the flow and breastfeed. If you're facing difficulties, you always know, go meet a lactation consultant. She's been preparing the baby for 9 months. All those moments that your baby has been doing in utero, that's actually preparation for birth and thereafter for breastfeeding. And your body has not been quiet either. So colostrum is there from the 5th month. So many mothers say, no, doctor, I didn't eat. I had cesarean yesterday. I didn't eat. I just had breakfast. So I think from today my milk will start coming. So to really know that your body has been preparing, it's not like it's waiting for you to eat breakfast and then the milk will come. Your body has been preparing all along. So just being aware, being informed, trusting the process, keeping it as natural and simple as possible, holding your baby a lot skin to skin, and feeding as often as possible. But then, as you know, life can happen. Maybe things will not go along the way that you have planned. And as you would know, as an LC, meeting mothers who are really stressed out and disappointed and, wondering what they've done wrong that the baby is not coming to the breast. So then we have to kind of counsel them that breastfeeding is not the only way you can mother a baby. There are hundreds of avatars that breastfeeding has. It could be direct feeding, it could be supplemental feeding at the breast, it could mean finger feeding, it could even mean bottle feeding. But you do it as close to you as you can and do the best you can and just go with the flow.
Yeah.
So that is what I generally tend to tell mothers. Be very calm, be very relaxed, and be in connect with your baby. I think that really helps breastfeeding a lot.
Okay. Thank you. Thanks for that.
All right.
That was a beautiful conversation. I've always wanted to have this with you because the moment I met you in Mumbai for that conference, I was wondering, pediatrician come IBCLC. Wow, great combination.
But I think there are some of us in India, quite a few.
Yeah. So thank you, doctor, again for sharing all that. Thanks a lot for joining with me.
Yes.
Yeah, even breastfeeding week is over, but then I wanted to just carry on with these conversations. That's why.
I'm so glad I could chat with you, Swati.
Yeah. Bye. Thank you.
Thanks.